Welcome back, everyone. Today we're moving into Concept 2 of dental anatomy, and this session is all about understanding what lies beneath every diagnosis and procedure. By the end of this class, you'll not only remember anatomical names, you'll be able to connect them directly to what you do clinically. So get comfortable, let's dive in. In this lesson, we're focusing on three major building blocks of dental anatomy. 1. Skeletal components. We'll look at the skull bones that support every dental structure. 2. Tooth structure. Here we break down tooth layers, enamel, dentin, pulp, and understand what each one does. 3. Basic tooth morphology, because understanding shape gives us insight into function. By the end, everything will feel much more connected and logical. Now, let's start with the coronal anatomy, the crown of the tooth. This is the part we use for chewing, speaking, smiling, and most importantly, treating. Every ridge, groove, and surface plays a role in function. And when you understand crown anatomy well, it becomes much easier to diagnose fractures, caries patterns, and restorative needs. Now let's zoom out for a minute and look at the bones that support the teeth. These include mandible, the only movable bone of the skull. Maxilla forms the upper jaw. TMJ, the joint that lets us talk and chew. Ramus, condylar process, mandibular angle. These determine the shape and movement of the jaw. Alveolar bone, the home for tooth roots. Chin, temporal bone, external acoustic meatus, and more. When you understand how these bones fit together, you also understand occlusion, jaw movement, and even patient complaints like clicking and pain. Now let's move to the tooth structure. This is one of the most important slides, the internal anatomy of a tooth. Let me break it down naturally. First, enamel, the hardest tissue in the human body, protects the tooth. Second, dentin, not as hard as enamel, acts like a shock absorber. Third, pulp chamber, the tooth's life source, contains nerves and blood vessels. Fourth, cementum, covers the root and anchors the tooth. Fifth, canal and apex, route for nerves and vessels to enter. Sixth, gingiva and bone, the supporting structures. Each layer responds differently to decay, trauma, and restorative procedures. Understanding this makes diagnosis much clearer. We've covered a lot so far: tooth structures, skull anatomy, and much more. Now let's understand dentition terminology. First, anterior, the front teeth, important for aesthetics and cutting food. Second, posterior, the back teeth, designed for grinding. Third, maxillary arch, the upper jaw. Fourth, mandibular arch, the lower jaw. These terms are essential for charting, diagnosis, and communication between dental professionals. Now let's look at how primary teeth are identified in dentistry. For baby teeth, we use the universal tooth numbering system, but instead of numbers, we use alphabet letters. The upper primary teeth are labelled A through J, and the lower primary teeth are labelled K through T. The sequence begins from the upper right second molar, which is labelled A, and then continues across the arch. This system makes charting and communication very clear when working with young patients. Finally, let's understand how baby teeth come and go. First, shedding means the natural exfoliation of primary teeth. Second, transitional dentition period is when both primary and permanent teeth are present. Third, transitional dentition refers to that mixed dentition phase, a mix of erupted primary and permanent teeth. This phase is crucial because spacing, crowding, and early loss can all affect future alignment. All right, everyone, now that we've covered primary teeth, let's shift to the teeth you'll be working with the most in practice: permanent dentition. Permanent teeth use the universal numbering system. Here's how it works. We start from the upper right third molar, that's tooth number 1. Then we travel across the upper arch all the way to the upper left third molar, tooth 16. Once we finish the top arch, we drop down to the lower left third molar, tooth 17, and finally move to the lower right third molar, tooth 32. So upper teeth are 1 to 16 and lower are 17 to 32. A complete adult dentition has 32 teeth. Now, before we move into more complex terminology, let's clarify the basics. We divide teeth into two main groups: anterior teeth. These include incisors and canines. These are your aesthetic teeth, responsible for cutting, slicing, and of course, the smile. Posterior teeth. These include premolars and molars. These are your powerhouses for grinding and crushing food. When you write dental notes or explain findings to patients, these terms help keep communication very precise. Next, let's explore the essential directions and surfaces we refer to in dentistry. First, mesial, the surface toward the midline. Second, distal, the surface away from the midline. Third, lingual, the side facing the tongue. Fourth, buccal, the side facing the cheeks in posterior teeth. Fifth, facial labial, the side facing lips for anterior teeth. Sixth, every dental charting, restoration, cavity classification, and orthodontic movement uses these terms. Once these become second nature, everything else becomes easier. Let's continue with a few more important surfaces. Occlusal, the chewing surface of posterior teeth. Incisal, the biting edge of anterior teeth. Cervical, the area near the gum line. Apical, toward the root tip or apex. Interproximal, the space between two teeth. Vestibular, the space between your teeth and cheeks, lips. These terms help dentists describe lesions, restorations, periodontal findings, and even orthodontic movements with absolute accuracy. Let's talk roots, something crucial for endodontics and extractions. Here's a simple breakdown: incisors, canines, and most premolars, usually one root. Maxillary premolars, commonly two roots. Mandibular molars, typically two roots. Maxillary molars, usually three roots. Why is this important? Because root numbers determine extraction difficulty, canal treatments, and even bone support. Now imagine you're running a clinic or managing multiple dental tasks: billing, insurance checks, patient documentation, telehealth support. It gets overwhelming, right? So the real question becomes, where can you get all these essential services in one place without juggling 5 different platforms? That's where the next slide answers this perfectly. So here's how Qiaben brings everything together for dental practices: EMR and telehealth, smooth patient management, virtual visits, and digital documentation, medical billing and coding, accurate code entry and timely reimbursements, insurance verification and pre-auth, quick checks to avoid costly delays and claim denials, cut costs by 50%, efficient processes that save money, time, and staff workload. Qiaben basically becomes your clinic's digital support system, so you can focus on what matters most: treating your patients. What would smoother insurance verification mean for your clinic? Fewer delays, happier patients, better cash flow. And that brings us to the end of today's session. Thank you for learning with me. If you want to explore Qiaben or need support for your clinic, here's how you can reach us. Phone number and website are right on your screen.